Good morning, everyone. I also want to give a huge shout out to Beth and a thank you to Zoe and Denise for helping to organize this. I'm really excited to connect with all of you. My name is Jessica Morse, and I am the Suicide and Overdose Fatality Review Public Health Associate. I'm one of 3 individuals at IDOH who helps to support our county level suicide and overdose fatality review teams. Indiana currently has 31 teams covering 32 counties across the state. So we've got just over a third of the counties covered. And suicide and overdose fatality review teams bring together the multitude of local stakeholders who are all working in the mental health and substance use disorder space and who interact with individuals who may have died by suicide or by accidental overdose. And they take a look at this individual's life and evaluate all of their interactions with the system and look for missed opportunities to intervene and maybe change the system a little bit or change their own practices a little bit to prevent future deaths from occurring. Fatality review is not meant to be a blame game. We're not placing any blame on individuals or saying that this was this person's fault. It's really just an opportunity to kind of break down the silos of work in the community, bring together all of those partners, and work towards coming up with recommendations to prevent future deaths and just create a happier and healthier community for all Hoosiers.
Wonderful. Thank you so much for sharing that, Jessica. So talk to us a little bit about how CMHCs can directly partner.
Absolutely. So CMHCs can take a plethora of different roles in the SOFR space. We have a lot of really wonderful teams run by some of your organizations, the Bowen Center, LifeSpring, Oak Lawn. I'm probably forgetting some of our other partners who actually coordinate the teams. Beth Keeney herself was one of the first, and Clark County was one of the first coordinators of SOFR team and helped us pilot that. And then also just bringing your expertise and your records to those teams. So a little bit later, I'll be sure to drop a map of where all of our SOFR teams are. And if you're not already connected with the team, I'd love to get you connected with our coordinators so that you can both bring any mental health or substance use treatment records that you have for individuals that we're reviewing, but also your own experience just in general to work at creating prevention recommendations.
Great. Any questions for Jessica before we move forward that are on your minds?
Zoe, could I just jump in for a second?
Of course.
I just want to let everybody know if you're interested in seeing a team or if you want to just kind of see how it operates, you're welcome to join us in Clark County. We do it virtually every month. So just shoot me an email and I'm happy to help facilitate that.
Great. I appreciate that. Maybe walk us through what happens in one of those.
Yeah, absolutely. So after a team has been formed, they either receive the records of individuals who die from the State Department of Health. We'll send them a list of individuals, or they work with their health department or coroner to pull a list of cases to review. Every county bases their review and has different parameters, but the general one that's been legislated, that's another important fact that I missed, is that the Indiana legislation actually passed a bill that allows us to pull these records and to do this case review without violating any HIPAA protections or violating patient privacy, which is a really awesome win for us. So at these meetings, the cases have been pulled, and then the coordinator of the team works to pull all of these records together. A lot of our teams choose to showcase information in a slideshow, and so we've pulled demographic information. A lot of this is found on the death certificate. If we can, we get access to the death investigation itself and go over what happened at the incident of death, toxicology reports, any obituary or social media information we can find, we also share. We just try to really paint the picture for this individual's life. We pull medical records, behavioral health records, criminal justice records, and then the team comes together. The team is full of a wide variety of partners in the community in all different fields, law enforcement, education, DCS, mental health, medical, et cetera, et cetera. We try to keep our teams very diverse. Peers are a really important aspect of our team. Peer representation is key. And then everybody comes to the table and they go over what they know about the individual, what records they were able to pull, and kind of form a timeline of events in this person's life. And then at the very end, after the team has been presented all of the information and shares any information that a team member brings forward, we talk about recommendations for what gaps existed, what were potential missed opportunities, where they could have reached out maybe this way, or had the person involved in this program, or maybe even celebrating a success of, oh, this was a really fantastic way that this organization intervened in this person's life. And that all comes together in recommendations. And then the recommendations are then pulled together, and we recommend about once a year a team has a recommendations meeting to talk about all of the recommendations that they've come up with and how they can actually begin to act on them.
Great. And Jessica, I just wanted to know that if you see any trends within those recommendations, that is definitely something where the council can come alongside you from a policy standpoint, and be able to advocate for policy where you might not be able to do that. I can. And so that's how we work with our state departments and trying to get those that we serve the care that they need. So just if you notice any of that, I'd love for our public policy committee, a number of folks on this call are part of that, to be able to review that. Actually, Beth is one of the ones who leads that. So I appreciate that feedback too. So how can people get connected if they're not already connected?
I will put my email in the chat. Feel free
Right.
to email me, and I can connect you with the local coordinator for your SOFR team. We are fortunate enough that we're connected to all of our suicide and overdose fatality review teams. So I'm happy to facilitate that connection and let you know who started the team in that county. It's not publicly available anywhere else, just to protect them from getting a slew of emails. Beth already gets enough emails from me.
Yeah, that's great. What else did you want to share? The map of the regions and share any other resources with the group that would be beneficial?
Yes, I would love. I also just want to talk about the numbers for a second.
Sure, absolutely.
And kind of just talk about the importance of having the input of your records and your participation in these teams. So just in general, the incident rate for suicide in Indiana is 19.7 deaths per 100,000 adult Hoosiers in 2018 to 2022. And for overdose, that's 42.5 deaths per 100,000 adult Hoosiers. After a case review, our coordinators go and enter all of this information into REDCap. And from REDCap, we found that 48% of the cases that we reviewed, these individuals have had a known history of mental health problems or diagnosis. And this is just the known history. We find that there's sometimes a gap with accessing their treatment records because of the protections in place. And of those with a known history, only 19% had had a known visit with a provider for mental health treatment prior to their death. And we think that these numbers are a little skewed because that's just the information that we have access to. So we really just want to paint a fuller picture of these cases and of these individuals' lives so we can really get to the heart of what happened.
Well, and I think that, with those numbers, something that really, I think is promising for all of us is the great work we're doing around crisis response and mobile services and crisis stabilization to connect people. Because if there's such that gap, there's people we are not reaching. And so I think that is a huge opportunity for us system-wide.
Absolutely. And we've actually had mobile health integrated teams and certain crisis response teams and also grief support teams that have come out with our come out with our SOFR teams, which has been really cool to see. One of the most popular recommendations that's actually been put into action is the local outreach to suicide survivors, lost teams, which reach out to families who have lost a loved one to suicide. And provide grief support throughout the important dates in that individual's lives. And sometimes that even grows to a DOS team, drug overdose survivor support. Um, and the same grief support is then provided to those who have lost a loved one to overdose.
Great. You're
Sorry,
allowed to share your screen.
perfect. Let me just
Thought I
pull
could give
up
you access.
the
While she's
map.
pulling up, any questions that the group has, anything that we have not highlighted that you were hoping to hear more about? Is everyone finding this beneficial and thinking of ways that we can connect with our local teams? Seeing lots of
Okay,
heads. Okay. You ready?
I can share my screen now if that's
Okay.
okay.
Yeah, absolutely.
So this is the, can you see this?
Yes.
Okay, perfect. This is the current map that we have. It is a little bit outdated. A team just started in Kosciuszko County. They just had they're having their second meeting this month. And then Brown County is also starting a team this month. So we have we're pretty evenly dispersed. We definitely want to get into that southwestern region of the state a little bit more, but the benefit of that Health First Indiana funding is that we have a lot of interest in counties all across the state.
Lots of opportunity there, though, for people to plug in.
And then let me just put my email in the chat.
And Jessica, while you're doing that, I was wondering if maybe the teams who have been started for a while, if anyone wants to kind of highlight the benefits that they've seen, and anything, to kind of help in getting us full coverage on this map. I didn't know, I see Lori on, Beth, if anything you guys wanted to highlight.
I think from my perspective, the benefits are, first of all, you get real-time information about what's going on. So we've been able to, see some emerging drug trends before we get any communication about it. And then also LifeSpring has been able to make real-time practice improvements. I know Jessica talked about doing a once a year recommendation review, but there have been things that we've left the meeting and went, okay, we're going to change this right now. And I think having the ability to freely communicate about what we know and to receive information about what others know really helps from that system level close some of the gaps that exist in the community.
Great. Thank you, Beth, for sharing. Anyone else that is plugged into these groups that you want to provide any insight on?
Zoe, this is Diana.
Yes. Hi, Diana.
Hi, Diana Huddleston from Aspire Indiana Health. We have clinical team members that sit on the Hamilton and Boone teams. I agree with everything that Beth said. And I also, it's been a really nice way for our teams to be connected to others in the community that we might not have been. And to build those relationships, and just for all of us to really understand the services that we offered and be able to get families connected. It has, when it first started, there really was a trend of people that no one had had contact with, and we have to be able to get our stories out, and just sharing with one another and just building more networks has been beneficial.
Wonderful. Thank you for sharing that, Diana.
Mm-hmm.
Any other insight from the group? Jessica, any other key things you wanted to highlight?
I'd also just like to say that if you see a region that you have a lot of access to or that you oversee, that you feel really passionate about maybe starting your own suicide and overdose fatality review team, please reach out to me. I'm happy to just do a quick informational meeting to talk about kind of what goes into that and how much time it takes and what that process looks like. I'm happy to connect to provide more information. I'm going to stop sharing my screen now unless anybody would like me to keep this up.
No, but we could include that with the recording so that people have that as a point of reference on our website. So if you would email that to me, Jessica, that would be great. Send that out. Any other questions for Jessica? All right. Well, I'm going to thank you, Jessica, and I'm going to move to just some key things that I want to make sure the group is aware of. A lot of this came out in my update, but in case we needed to talk anything through, since we do have a little bit time, Jessica, thank you so much for your leadership in this, and we look forward to partnering with you. Just a few save the dates that I wanted to call out for everyone. If you have not already signed up for the class workshop on June 17th and 18th, that is the work that the Indiana Council's Racial Equity and Leadership Committee led along with DMHA. And so that is really the learning opportunity from the assessments that each of you completed. So I highly encourage all centers to have representation at that training. I unfortunately will not be there. I will be presenting on Indiana's journey on CCBHC to the California Association, because believe it or not, we're further along than California in CCBHC. So that hardly ever happens from a policy standpoint. So I'm going to share that, but Leanne and Denise will be there some, and so you can connect with them if you need anything from the council. Our open office hours is June 24th. July 9th will be Andrea Kearns regarding the OKRA funding that the governor's office has, Lieutenant Governor's office has given. It's little bits of funding, but I definitely think there's some opportunity there for our centers to learn more about that funding opportunity. And so she will be our guest on July 9th. And then we will be, I got to practice my baseball swing. And we will be in Fort Wayne, and we will, for our social event, be doing batting cages. So Denise has done a phenomenal job with setting that up. We'll have our in-person committee meetings. We have a very strong agenda on July 18th and business meeting July 19th. I also wanted to know, I am aware that our October meeting is the same week as our Indiana Primary Care Association but friends, and we did our best to try to avoid that, but unfortunately we were both locked into contracts. And so maybe you could go to South Bend for IFCA and then come down to Bloomington, or divide and conquer, but that is October 9th, 10th, and 11th, and we are offering a discount if you register for both. But this will be all things CCBHC, and we're really going to be getting into some of the weeds now that we know that we got the demonstration and what those next steps are. So I would really encourage everyone to be there, because a lot of work is going to be done to get us ready for the demonstration come January 1st. Wanted to really personally thank everyone who attended Hill Day last week. Several folks are on the call. We really saw Indiana on the federal advocacy stage with Representative Bouchon and other support for CCBHC. We also received commitment and interest from Senator Braun's office, and I know that's all on our hearts and minds as far as how this is going to transition with the governor. But really, that probably, I asked the group, and that was the #1 meeting that we all enjoyed because of the interest and the commitment that we heard. And so I really think it's going to lead to great things that we were able to do those meetings along this transition period. And then state policy, we are determining our platform as, since we were awarded demonstration, but there's still a lot of opportunity, as we know, around crisis. group homes, and workforce. And so what is that going to be from an ask standpoint? We do also need to manage our expectations because, as we know, with the Medicaid shortfall, any ask is going to be challenging to get through. But we are framing those around those three high level things. And so more details, and when we get our platform out to share with everyone. I hope if you have not connected with your state legislators while they're off, that's on everyone's agenda, as well as federal, because I'm telling you, those local visits, the visit Representative Bouchon did at Centerstone and Southwestern, that is where his love for CCBHC and learning about that came from. So we're able to thread that needle because of your local connection and your local support. So thank you for that. And then we don't know a timeline yet. I've gotten this question from several folks regarding the adding the other 16 into the demonstration. We met with DMHA yesterday. I'm continuing to advocate that we at least need a tentative timeline, a tentative what's next. And so they are working on that. The primary focus, though, for them is to have the 8 ready to go with the demonstration January 1st, because we want to make sure that that demonstration is strong and that there's no risk for that demonstration come January 1st. So more to come on that, and I will keep everyone updated. And then as far as other council updates, the council did advocate on your behalf for around $5 million that will be going into a group home, room and board per diem. We are working on finalizing that information with DMHA. This information will be part of your contract. And so if your contract has already gotten sent, you will get an amendment, and it will be a room and board based off of group home beds and occupancy. So more to come on that, but that I know that that's not going to solve the problem, but it is a step in the right direction. I want to thank all of you who put the work behind that. And really, Scott Riggs at Meridian was the first individual to really kind of lead this and help us with getting this room and board pulled together. So thank you for your work on that. And so more to come. And then I just signed a scope of work for Blue and Company to assist us in our denial study around the Kipro and Essentra situation. You will be seeing our financial folks and CEOs will be seeing some very specific asks from Blue and Company to help us with pulling together this denial study. And so this study we will be pulling together for our next meeting with FSSA so that we can advocate for the money that has been denied to come back to our members. So I wanted to give everyone a heads up on that. I have not yet seen the county report template yet from DMHA. I will ask again on that. But I have heard from some of you regarding the county allocation and an update on that. If you are needing that to be able to invoice your counties, I do have a form that would help in calculating that. And I'm working on getting a list that will summarize all of that for you guys. And then mobile billing, we have not seen the FAQ out. There are currently 13 CMHCs that have been designated. And as soon as that FAQ is done, I will make sure to share that with everyone. I did want to also thank Raylan Crockett at Edgewater. She's the winner for our gift card on our member survey. We had huge success on that member survey as far as engagement, and have learned a lot as a team of what we can do to continue to bring value. So thank you to all of you who completed that. And then just a reminder, if you know of any potential members, and now that we have demonstration, the lens to look at that through is designated care organization. So anyone you think you're going to partner with, I would love for the council to also offer that support and be that one who brings everyone together under policy and federal policy. So if you know of any potential members, please reach out to Leanne Jordan. And also our PAC is hugely important, especially during this governor race. So I wanted to highlight all of that for you as well. Any questions for me? I know I just shared a lot, but that is everything that is going on from a council standpoint, both policy-wise and assistance with CCBHC and group homes. Any questions for me that I did not highlight?
Zoe, I think you answered it, but the group home money, that's a one-time thing at this point. Is that right?
Correct. That's a one-time thing. But I think with this budget session, and now that we have demo, we could maybe put together an ask for that again, like we did the last time.
Well, it's great. I mean, I never thought I'd see it happen. So there you go.
Yeah. Well, thank you, Lori.
Hello, Zoe. This is Art Fuller from Hamilton.
Hi, Art.
How are you?
Good. How are you?
So you had mentioned the Senator Braun meeting, and are there any things that we can begin to think about in ways to just help the Indiana Council just with any follow-up related to the Senator Braun?
Well, we will be writing a transition document for his office like we discussed with them last week. And so Beth, Keeney, and public policy folks, that transition document will be shared with everyone. And I think all of us having that same message during this transition will be extremely helpful. So as soon as we get that done, our goal is by the end of July, we will be sharing that with all of our members and talking that through. That's a great question, Art.
Okay, thank you.
You're welcome. Any other questions or needs? Well, we can't go without having a Starbucks winner. And so that is Carrie Lewis at A&C. So Carrie, you are our Starbucks winner.
Zoe, we have one more comment, I think.
Oh,
Sorry.
that's fine. That's fine. Yeah, go ahead, Art.
Hi, Zoe, it's Megan Creech. I just had a quick question on the amendment to the contract regarding those funds for group home. Is there a timeline on that when we can expect that to come through?
Well, yeah, because they were waiting for the new fiscal, so July. So because everything, it's pretty much a dead period with anything fiscal at the state until July. So we should start seeing those start happening probably mid in July.
Thank you.
You're welcome. All right, let's raise our cups. Cheers to all of you. Thank you, Jessica, for being our guest. Thank you, Beth, for suggesting it. If you have any other suggestions that would be good speakers for Cup of Joe, please don't hesitate to pay those forward. I'll see a lot of you either today at the round table with the Surgeon General or tomorrow. So looking forward to that. Oh, that was one other thing. There was a group who covered covering kids and family last week, school-based services, and then there's going to be another group of our CMHCs tomorrow. So make sure to come and see that session, and I'm really grateful for them in doing that. So cheers to everyone. Congratulations, Carrie, on winning, and we will see y'all soon. Have a great day.